Hi, welcome to Momspiration Unpopular Opinions. So, welcome everyone. I have my sister today with me. So,
Hi
welcome,
everyone.
Pratibha.
Glad to meet you, Priya, today.
So, I want to start with, an introduction about myself. So, I'm Priya. I am 37-year old. I am a single working woman in Canada. So, I came to Canada in 2019. So, I've been living here since then. And I now want to hand it over to Pratibha to give a quick
Okay,
introduction
so hi
about
everyone.
herself.
I am 32-year-old single working woman working in India. So basically I'm staying in Delhi and I'm working as a consultant in one of the top MNCs in Gurgaon. So yeah, that's it about me.
Awesome. Awesome. Thanks, Pratibha. So, we are both sisters, if anyone couldn't tell, but we are 5 years apart. So, I am older, she's younger than me, and we both have, different social media profiles. So, I have a podcast, and Pratibha does a lot of videos on mindfulness, and my videos are mostly based on women and women empowerment. And I just thought that it would be really nice if we could do a video together where we can talk about both and our personal experiences, and especially how we both have inspired each other in different areas of our life. So as far as Pratibha, she has inspired me because I know she has been through a lot of personal experiences, personal struggles, and how she overcame those with practicing mindfulness and learning about spirituality and all those really great areas. So I want to talk about those things today because I know there are a lot of women out there who are experiencing similar kind of situations, whether it's work, whether it's their health. And especially with women, what happens is that um, we usually isolate ourselves when we go through challenges and personal experiences because mostly no one understands us, and also there is very less knowledge out there when it comes to like women's health. And also there are some health areas that we feel embarrassed about, so we don't really share those things with others because we feel that, oh, like, what are people gonna think. So when Pratibha went through these challenges, I I always told her, like, when you get through this, you should definitely think about helping others and talking about your experience. So that's what I want to do today. So um I want to start with asking you, how are you doing today, and recently, how
Yeah,
has your
it's
health
been
been?
great. I mean, my life has like completely transformed from the past 1 year. Like since the time I had started practicing mindfulness, I would say that my life has become totally new. It's like I'm living a new life because the way I look at life right now is completely different. So I would say it's beginning of a new Pratibha and the ending of the older Pratibha. So my health has been great. Of course, there are certain ups and downs which keep on happening, and I would say that I'm still learning. So yeah, this is the journey which I am totally excited about, and I don't now get afraid of facing those challenges, and I know I still have to keep learning and growing myself.
Yeah. So let's go back a little bit and talk about how everything started. So I think, do you remember what age you were in when you
Yeah,
started
so
having
I
health
think that was the
issues?
time when I had just started off working. So after I had completed my graduation and I was working for longer hours, so at that moment I was not taking care of my health, and at that moment of time I started getting some digestive issues and things like that, right? So I think it was around 6 to 7 years ago.
Okay, okay. Yeah, I remember. So I think it was like when you started your first job, and I remember that, you used to travel to from
Yeah,
Delhi to Noida, I think, and
yeah,
you used to take metro. And people who don't know that, how far you have to travel to get to that job is pretty far. It's
yeah,
like 2 to 3
yeah,
hours, if I remember correctly. So one way, yeah, so that was
yeah,
like one way. Yeah. And then, so yeah, so basically that, and then you go early in the morning, and then you come back late at night. And I just want to express that how difficult and challenging that is, because sometimes we just take things like, oh, okay, this is normal. But the truth is, this shouldn't be normal. We shouldn't be normalizing this, that, oh, it's normal to work long hours and it won't take a toll on your health. So basically what happens is, like, you go to a job, you, because you're also a fresher, like it's your first job, you also put a lot of pressure on yourself, because you're like, I want to prove myself. So you tend to like ignore your physical health and mental health. So sometimes you don't even have lunch because, maybe your manager says, like, I need this today. And you're like, oh, okay, you're scared. So sometimes you skip lunch, or you just like eat junk food, and you don't really take care of your physical health. And then also, you come back late at night, you're sitting in, even if it's like metro and you get a seat in the metro, you're sitting the whole time, which is also not healthy. um but yeah, those things I don't think people think about, because they're like, oh, it's okay, I'm young, I'm not having any issues right now, we'll see when we have issues, right? So, was that kind of your mentality at that time, or like how were you thinking about your health
yeah.
at
I
that time? Do
thought
you
that
remember?
since I was a very active kid, I realized that I did not do any exercise apart from just going to work. I thought that okay, I'm just traveling, so that was my only priority. That I just had to go to work, do my performance there, and come back. And I had not given priority to working out or just taking care of my physical or mental health. At that age, we are so much like focused on our career that we just want to achieve corporate ladder, and we just think about just our performance cycle, right? So we always tend to give that priority instead of our own health, and we actually tend to neglect what is important for us. So I would say that when we are very young, we tend to neglect our physical body, and we just feel that we don't need to take care of it at that age.
Yeah. Yeah, and I think also we just tend to think, or we give an excuse to ourselves also, like, oh, I'm busy, I don't have time for that. Even if like someone tells you that, oh, like maybe you should exercise for like 30 minutes, you're like, no, I don't have time, I'm tired. And I mean, I understand why that is, but I think it's not just your problem, but like the work culture in India as well, like how problematic it is, and how people don't care about health and anything else. They just like push themselves to a breaking point. So I think that really needs to change, because either you have to reduce the hours you travel to work, if you want to work longer hours, or like have some kind of like flexible work culture where you're allowed to work from home, maybe for like 3 days, and 2 days you can go to the office. Because honestly, I think everybody knows that traffic is such a problem in India, and then also like traveling to work is a huge issue. So I think that's one of the factors that contributed to, you having health issues as well. So that's why I wanted to bring it up. Um, so the second thing I think I want to talk about is also mental health. So we talked about physical, but what about mental health? Were you thinking about anything related to your mental health at that time, or how were you dealing with any kind of like stress or any kind of issues that
So I
came
would
up?
say that during that time, I don't think I was like, I did not have any thoughts about any kind of mental health. I thought that it's just my physical symptom. I thought that it's just because of the food I was eating, or because of negligence of my own body, that I was facing those physical symptoms. So I had not thought anything about mental health, and I had thought that this meditation and all are the things which you do when you are stressed out, or you are in a burnt out situation. I did not had a clear understanding of,
Understanding
what's
of
the
it.
purpose behind doing meditation. And I was also facing difficulty to meditate also, because I was not able to concentrate while I'm doing the meditation. So I thought that at that age it was not at all helping me out, and I was also wondering that why they keep on asking us to focus on our breath. So I was not at all clear that, okay, what is the scientific reason behind that. But like, when I had started doing some research, and when I started listening to different neuroscientists, I got the reason of why we focus on our breath, right? So understanding the reasoning behind meditation is
Hmm.
also important for anyone who wants to start it off at the first place.
Yeah, I think I agree with you that even during that time, like I had honestly no knowledge of, mental health. Like, what is mental health? Why is it important? How do you maintain it? What's the reasoning behind all these things that people are saying that, and even how mental health is related to your physical health. So, I think that's something that a lot of people are not aware of. We just see
Yeah.
physical issues as physical issues, but people are not aware that a lot of your physical issues, mostly, I would say like 99% of them, are due
Yeah.
to your mental health. So, um, so yeah, I think mental health is very important, and we just don't give it enough. Importance. And I think one of the first reasons is awareness. Like, no one is aware of it, and a lot of, I think it, I would say the blame is on, the education system, and then also, the knowledge that is spread around, because like there's nothing, I don't think there's um talk about mental health as much as it should be, even in the media. Like right now, yes, they do mention mental health, but I don't think it's talked about so much that it should be. And then also, like, in schools, in colleges, and at your work, everywhere, I think everywhere there should be, mental health related classes. And I think just for people to understand, like, why is it important. Just like, we have science in our school education system, but it's physical. They talk about your physical body. They talk about, okay, this is what your heart does, this is what your lungs do. But they don't talk about, okay, the brain and the mind. Um, and especially after I've learned like how much your mind and your brain operates everything, I think it's hugely ignored, which is very wrong. And I think that definitely needs to change if people want to be healthy. They want, their children to have a better future. So I think one of the factors is this. And then the second thing is that, people also need to um, kind of realize that um, they cannot just rely on their doctors to take care of their health. So we will talk a little bit about this more when we talk about your experience in detail. So the next question I have is, talk about your health issues. What was it? What When did you realize that, okay, this is happening? And initially, what was your experience with, I would say, like healthcare system in India and the
Okay.
doctors in India?
So initially, I had faced certain digestive issues, and I had gone to a gastroenterologist. So I told him my symptoms, that whenever I am like eating my food, then I somehow don't feel like comfortable, and I feel like there is a lot of constipation, and so he had asked me to get my checkup, and that's how I got to know that I have like severe problem of constipation, and also had chronic fissures. So chronic fissures are something where if you have a lot of constipation, then there are cuts in your lower area, and you feel a lot of pain. So pain is so severe that you get scared of going to the washroom, right? Because you don't want to face the pain which will come after going through that motion, right? So when I had that checkup with the doctor, then also I felt so much of pain that I had literally started crying, because the pain is so huge that you don't expect that, okay, why is this pain coming into my life, right? So that was the first time I had gone through such a severe pain, and that's how doctor told me that, okay, you have got chronic fissures, and you have to take care of your diet, you have to take care of your digestive system, and make sure that you don't get constipation problem again. But he had given me prescription for 5 days, but then those symptoms came back again. So my problem was not solved in just 5 days, and that's how the problem increased for like almost a year. So I think that was the initial stage when I had gone to a doctor, and I realized that, okay, this is something chronic, and something which I'll have to basically manage and see a different kind of medicine. So I had tried like allopathic, I had tried Ayurvedic, I had tried homeopathic also, and I had like visited multiple doctors back to back, and I was so like frustrated with like taking different medicines, and I was not at all getting any relief. So the relief was like just for a few days, and then the symptoms used to come back again. So I was spending a lot of money on going to the doctors and taking the medicines, and you feel a lot of pain, right, if you're spending so much amount of money and you're not getting any relief, right? So that's a frustrating point where I realized that my mental health is also suffering because of the physical symptom. So it was like a vicious cycle which came, right, that I used to get stressed out because of my health conditions, and then my health again used to suffer because of that. So it became a constant cycle of suffering.
So let's talk a little bit about more about your symptoms. So obviously you had pain. So whenever you needed to use the washroom, you used to experience that pain. But then besides that, what else, were your symptoms?
um I would say that it was just like after I used to go to the washroom, then when I used to come back, then the pain used to last for almost 5 to 6 hours. And then when I had initially started taking painkillers, it gave me relief, but then also the painkillers had stopped working because I was taking them on daily basis. So the painkillers at some point also had stopped working for me. So that was the issue which I faced, that okay, now how would I deal with this? So I started having lower back issues as well because of the strain, and I also used to feel like a lot of like I did not enjoy eating food because I was so much scared,
Eating
and I
food,
had
yeah.
so much fear that I will have to go to the washroom. So I was avoiding to eat food. So that was the thing which had
Mhm.
almost led me to a lot of weight loss as well.
Yeah. So another thing I also remember, I think, was like you also used to have like a lot of stomach cramps. Was that because of the medicine that you were taking, or was it just on
So
its own?
those cramps used to happen only like if I have a lot of stress or anxiety. So that usually happens if I
Okay.
am taking too much stress. It could be due to work or it could be due to anything, but it was on and off, and that condition is called as irritable bowel syndrome,
Mhm.
where if you are too much into anxiety, then you get certain abdominal cramps in your stomach. And I had undergone various tests
Mm.
to
Okay.
rule out this problem, and that's how I got to know that okay, this is
Yeah.
due to my anxiety.
Yeah.
And that itself I had
Yeah,
informed
that's
doctor
what
that this is
I wanted.
because of not of any physical thing which I am eating. I always used to mention this to him that I am always taking care of the diet I'm having. And because they used to always blame me for just don't take care of consuming good amount of water, or you don't consume
Yeah.
a lot of fibrous food, but that was not the case. I always used to tell them that that is not the diet which is causing me this issue. It is basically because of my anxiety. So they were not
Mm.
getting to the root cause of the problem. They were just focusing on just curing the
Yeah,
symptoms.
exactly. So that's what I want to talk about a little bit more. So initially, I remember that, when this problem started, when this issue started, um, you obviously you went to the doctor, and at that time, you didn't really have a good diet, you didn't really have a good lifestyle. But I can definitely attest to that once your doctor said that, okay, Pratibha, you need to do this to become better. You started practicing those, and you really like changed your whole lifestyle, like right away. And a lot of people don't do that. So I do realize that the doctors don't really trust the patient, because they've seen so many patients in this situation that, oh, like they tell the patient that you need to change your lifestyle, but they never do. So they don't really have that trust in patients. But there are some patients, like you, who do change everything. They follow every word of the doctor. Um, so that's what happened when you first started visiting the doctor. But I want to shine a light on how they didn't really take your word for it. And then also, they, I would say, didn't really look into, as you said, the root cause. Because when you started following the right lifestyle, doing everything the doctor was saying, even then the situation was not improving. And then for them to not believing you, or just saying that, oh, like, no, you just need to drink more water, or do more exercise, that doesn't really serve you in any way, because it's not making your situation any better. The doctor is not doing his job. Because if you're a doctor and your patient comes in with some symptoms, you diagnose them, and then you help them in their treatment plan. And then if that treatment is not doing the job, like curing your symptoms or curing your disease, then they need to like investigate. Maybe they need to like offer you some kind of alternative uh, treatment plan, medicines, whatever. But in this case, what we have experienced is that that never happened. The doctor didn't really look into, like, oh, okay, why is this not curing your symptoms or your disease, or what's the root cause? Maybe it's not your lifestyle, maybe it's something else. I don't know. But the point is that they didn't really talk about your mental health at all, which is very surprising and shocking to me. Because nowadays, you can't really say that no one talks about mental health. People are talking about it so much. They're like counselors and psychologists everywhere, but in this case, like, none of the doctors that you consulted, and you consulted like multiple doctors, none of them really, focused on, oh, okay, Pratibha, maybe, this is because of your mental health, maybe, this is because you have anxiety, maybe this is because, you're taking too much stress. Or even if it's not because of your stress, I think, doctors should definitely recommend to any of their patients like counseling or therapy if the patient is going through something serious, like a serious symptoms or serious disease, or and especially like um, any kind of health issues that involve pain, because pain management is definitely something that is very complicated, it's very tough. And since your issue was like constipation, like chronic constipation, I think that's also something that people don't really understand and don't really take it seriously. They're like, oh, constipation, okay. It's not a big deal. But the truth is, it becomes a very big deal when it becomes chronic, and when it changes, or there are other things that kind of like join into it, like hemorrhoids or something like that, and then you even need to have like surgery because of it. So don't think that, if you have like constipation issues, it's a small issue. It's not a small issue. If it becomes chronic, it is one of the most painful experiences you will have. So yeah, that's what I wanted to like kind of talk about here. So okay, so let's talk about, the kind of lifestyle that, you changed. So I know that, your doctor mentioned your diet and your lifestyle. So what did you start doing in your diet? And then also other lifestyle
So I
changes.
think a lot of lifestyle changes which I did was not based on the understanding I got from the doctors, because they always to give generalized advice to me that okay, if you have constipation, that then in natural products you can try out like isabgol, or you can try out any other supplements, right? But I always used to tell them that this doesn't suit my body. So there are a lot of factors which comes in, and I feel so sad that why do doctors give generalized medicine to every patient, right? Because every patient's body type is different, and you have to listen to patient what he's trying to say, right? That if the patient is saying that that medicine doesn't suit him or her, then they should try to understand, and they should not. So it's like whenever I'm telling my situation, they always tend to uh, change the conversation by saying that you have to trust us, you have to try it out this time, right? But that's not what I wanted from the doctors. I just like, even if they could give me certain assurance that you would be fine, or you would be okay, then that would have almost healed me. But that assurance I did not get, and that's the reason why my level of frustration kept on increasing. Because even when I used to cry in front of doctors, they were not at all like helping me out in any case. I know they are quite professional, and I know they don't really sympathize, but at least some amount of understanding they should get, because they also know about the pain, right? It's something which they have almost studied, that okay, this is the pain which that patient is going through and how they can help that patient, right? So there are a lot of lifestyle changes which I did. So firstly, the first thing which I learned was doing deep relaxation exercises. Since this is a thing which I have to face on everyday basis, I was very much in fear whenever I used to go to washroom, or whenever I used to come out of the washroom. I used to feel very much stressed and very much in anxiety because of the pain. So when I had researched about deep breathing, I had learned this concept from my mother, because my mother always used to tell me that okay, if you are feeling so much stress, try doing some deep breathing exercises. But at that point I did not take it very seriously. But then I suddenly had, I think I read some article where it talked about deep breathing techniques in order to relax your body whenever you are in chronic pain. So this is the first thing which I did, that when I first thing which I do in the morning is I tend to do some deep breathing exercises in order to relax my muscles. So once your muscles are relaxed, there is less pain. So this is the first lifestyle change which I did. Secondly, I drink a lot of water in the morning, because if you are sleeping for 10 to 12 hours, 8 to 10 hours of sleep at night, then our body is very much dehydrated. So it's important that you drink sip by sip good amount of water. You should not gulp it once. You should drink a small sip, so that your mouth saliva goes into your stomach, because the saliva in your mouth helps in digestion process. So these are the concepts which I have studied a lot, and they have really improved my digestive system. So first thing which I do is I tend to drink good amount of water in the morning. Then I do some deep breathing exercises, and then when I go to washroom, I also relax my body, so that my body doesn't so the connection is with my pelvic muscle. So if I am very conscious of this concept that my pelvic muscles are shrinking or they are contracting, I need to consciously make them relax. So once I make them relax, there is less pain. So this is the thing which I had to try it on my own, because no doctor had told me this concept, that okay, if you are facing this pain, how you need to manage it, right? This is
Yeah.
so simple. And they have like
Yeah.
easily
Yeah.
told me this thing, that okay, once you know, before going to washroom, you can do this simple deep breathing exercises. So this is the third thing which I do to relax myself. And then once I come out of the washroom, the next thing which I do is I tend to do meditation and pranayam also. So pranayam comes from the yoga concept, and I tend to do om chanting. I do some anum vilom exercises. So meditation and pranayam comes together, and like once I start doing them, automatically like the pain is gone. Like I feel that okay, I have the power to heal myself. So that energy source, I feel that automatically comes within my body, and then I feel like wow, the pain is no longer there. So that's something which, like once I
Mhm.
started, so initially when I had started doing it, the thing which I'm telling right now, that okay, I'm feeling like it has healed my body, then it's like it did not happen instantly, that okay, if I'm starting off the meditation or starting
Mhm.
off the chanting, it did not happen in just one day. I think it took around 6 months, 6 months of time, when my body got adapted to this concept of relaxing myself. And now whenever I'm waking up in the morning, now it has become my habit. So I don't have to consciously remind myself that okay, Pratibha, now you have to take deep breathing. Now it's become my habit that okay, whenever I'm waking up in the morning, I am doing deep breathing exercises, because that's the automatic habit which has become.
Mhm. Yeah. So, I mean, if people who are listening and they don't know about these breathing techniques, then you can definitely do research about it. And, it's related to your parasympathetic response. So, basically, your brain goes into flight or freeze mode whenever you face any kind of stress or anxiety or any kind of challenging situation. And this is automatic, so this is not something that only happens to some people, or it doesn't happen to everyone. No, it happens to everyone, where um you feel the effects in your body as well. So if you want to notice that next time you feel any kind of, like, even a small stressful situation, you'll see, you know maybe your hands, they become into a fist, or if you notice your jaw or your mouth, you'll see it becomes a little tight. So if you want to relax immediately, like you should just open your mouth a little bit and you'll see, oh, okay, I feel relaxed then. So it's the same with, your gut, or your stomach as well. So your whole body is connected with your brain, and especially your gut is directly related to your brain. There is a nerve that goes directly from your gut to your brain, which is connected. So what Pratibha experienced was also this, where whenever she faced a challenging situation, immediately, her pelvic muscles automatically, shrinked or contracted. And then, either, she felt it as stomach cramps, or maybe, she had some digestive issues. So, um, this took time to realize. So, a lot of people I know experience the same thing, but what they don't realize is that it's related to your mental health. um and a lot of these things are automatic, so changing them takes time, but that can happen. So instead of your body like shrinking and contracting whenever something happens, the automatic response can be changed to you being calm and relaxed, instead of like getting stressed and you know con- contracted or shrink. The thing that you mentioned about reassurance by the doctor, so um I want to really you know show the importance of reassurance here, because I think the bedside manner, or the way the doctors talk to the patient is a huge part of their recovery process. So when a patient goes to a doctor, especially like when they have some serious issues, I think the first thing that they're looking for is just for the doctor to like listen and understand them. And then, secondly, just reassure them. The treatment, like medicines or surgery or whatever, that comes, I think, in the third step. But those are like the first two steps that the patient is looking for, because they basically want some hope. They want to at least feel like, yes, there is some kind of hope, that that's what they're looking for. But right now, what is happening, especially in the Indian healthcare or Indian hospitals, is what I've noticed is like, if you go to a doctor, they will only talk to you for like 2 minutes. They don't really have time, so they don't really have time to listen to you, talk to you about your symptoms, or talk to you about your lifestyle, your how you're feeling. So they don't really have time to assess you mentally as well. So maybe they just look at you like, okay, I'm gonna check you, um, your physical symptoms, like, okay, your stomach cramps or whatever. But they don't really talk to you about, okay, how are you feeling? What kind of stress are you facing? What are you doing about it? These are your options if you wanna go to maybe a therapist or a counselor or whatever. But also, like, just talking to the patient as human to human, and just kind of like empathizing with them, because I think becoming like desensitized to your patient is not a good thing, because then you know you're not really kind of understanding the patient, or like serving the patient in a good way. Because um if you become desensitized as a doctor, you're just going to see the patient as a robot, like they don't have any emotions or feelings. And yeah, I think right now there's a need for every doctor to realize that reassurance is a treatment as well. So not so next thing that I want to talk about was, What do you remember, what advices that you did not take from the doctor? Like, you consulted different doctors, and what advice or suggestions or medicines or whatever, um something that they mentioned, that's not what you did, and instead, what did you do that was helpful?
So as I had known the root cause, right, that my root cause was anxiety, so there were like multiple suggestions which were given to me, like I
How Wait, how did you know for sure it was anxiety? Do you remember, like, was it like one thing that made you realize that okay, it's anxiety, or was it like over the months you slowly realized, or like, someone told you, or you did your research? Was it like multiple things that made you realize it was anxiety?
yeah, that's something like when I was going through those physical symptoms, I used to google those symptoms a lot. So whenever I used to google those symptoms, I like in order to find a solution, I used to spend majority of my time just finding the correct solution for this health issue, right? But it somehow aggravated the problem instead of solving the problem, and that's how my family members told me that okay, if you are thinking so much about the problem, you should think that okay, this is health anxiety, and you should definitely consult other doctors as well. So I think this was the first observation which my mother saw within me, and that's how I got to know that the problem is not in like my physical symptoms, but it's more of a mental health, that I'm over worrying over my health issues. And I used to just fear that because the google always gives you the worst case scenario, so you tend to feel that okay, what will the worst case scenario happen if the problem persists for longer time.
Hmm.
So I think with the help of my family members, and with my own observation, I realized this thing, that this issue is not because of the food I was eating, but because of my mental health.
Okay. Okay. And then you started doing these different things that you talk about, like breath work and yoga and mindfulness. Was there any particular person, or was there different kind of things that you went through to find what kind of mindfulness, or what kind of, you know I would say, like, mental health tips that you followed? So I remember that you used to, I think you went to like a psychologist as well, a psychiatrist as well, to talk about that, what kind of different things that you tried and experimented with, and then in the end, did you find a person that was, it made sense to you, and after that you really understood what mindfulness is?
Yeah. So like when I had realized that this is because of the anxiety, then I had gone to a certain psychiatrist, and the psychiatrist had given me certain medications. And psychiatrists always ask you if you are sleeping well at night, and if you are not, that then they will give you certain sedatives for you to sleep peacefully at night. So approximately 2 to 3 months I was taking those sleeping pills, because I was not able to sleep well because of my anxiety. But the other medications, which are your ssrs or ssris, which are basically, they are artificial serotonins which are
Yeah.
given to you, which boost up your mood, and which totally reduces your level of anxiety. So those medications which I had just started taking off, then the other symptoms became more worse. So my problem of constipation, my problem of digestive issues, abdominal cramps, and all those things came back again. So I was really surprised that if I'm taking the medicine for anxiety, then ultimately my symptoms should reduce, right, for the treatment I am getting. So
Mm,
my medicines were changed, I think 6 to 7 times, because those anxiety medicines were not at all helping me out,
mm,
because I was still facing that pain, and I was still facing those digestive issues. So at
mm,
that point of time, I was not at all in a favor of taking medicines. So uh, that's the turning point where I realized that if I don't want to take a medicine, then I have to take the accountability for healing myself. So initially I was dependent on doctors, or dependent on psychologists, or psychiatrists to cure my illness. But then I realized that if I'm not going to take medicine for my own body, I somehow will have to take action to heal myself, and there are other holistic ways to do that also. But certainly no doctor or nobody will tell you about that. It is under your, I would say, your environment, the like the family in which you have been brought up, or your awareness that you can get healed by this spirituality or holistic well-being.
yeah. So I think that you know you went on maybe like different social media channels, and you were like trying to listen to different people and learn from different people about mindfulness. So what happened after that? Did you start following certain people, or do you now, what do you do? Do you follow certain people, certain podcasts, or do you read books? About how do you get that knowledge?
So since I was like doing so much research on my anxiety, so whenever you are logging into your social media, then automatically those ads start popping up, right? That's the background algorithm which happens. So when I had like researched so much, then there is one ad which came up for mindfulness coach. So Alok Tank is a mindfulness coach, and I saw his ad which came up in my Instagram, and there he had mentioned that you can attend his session for 4 hours, and it will be just 99 rupees on a Saturday. So I thought of just giving it a try, right? Because I read his website, and he had mentioned the ways of dealing with the stress and anxiety. So that website was something which I got very impressed by, and I just thought of just attending it and seeing that, okay, how the session looks. So once I had attended that session for 4 hours, I literally got all my answers for dealing with your stress and anxiety. And firstly, I felt that it is completely normal for a person to feel anxiety, because when we are facing it for the first time, then we feel that, okay, this is something which is only happening to us.
Yeah.
So when I had attended his session, then the first like thing which he tells about is like totally the difference between stress and anxiety, why does it happen, and how you can immediately. So he told about like short term and long term ways of dealing with it. And then he tells about like what are the different techniques of dealing with your stress levels. So during that time, I was given hope that, okay, this is something which I can like study more. And because there are certain courses which he has mentioned in his page, so certainly those courses will make you totally you will get deep insights into how to handle your stress and anxiety and work pressure, and like the different kind of challenges which you face. And there are a lot of misunderstandings which we have with respect to happiness, with respect to stress, anxiety. So there are a lot of misunderstandings which I clearly got clarity from his courses. So that's when I realized that I need to change my autopilot mode into conscious mode, so that whatever I'm doing, I'm totally aware and totally conscious of my actions and my thoughts and my feelings also. So now once my I had like decided that I don't want to live accidental life where everything is flowing and I am just acting as the life is going. I don't want to be that person. I want to be the person who has a control over her thoughts, her emotions, and she has the power to transform her life.
Yeah.
Yeah.
Amazing. So now that you have followed everything, another thing that I wanted to mention here with the viewers is also that I think you've had surgery twice, right?
Yeah.
Is that right? Yeah.
Yeah.
So, and that was something that obviously you had to do because you had no choice, and your situation had become worse sometime at that time, and the doctors, that's what they usually recommend. um, but w- I feel like whenever the surgeries are also recommended by doctors, is like they don't give you the full picture of what's going to happen with the surgery. They just say things very casually. They make you feel like this is a very small invasive non-invasive procedure, and it's gonna take a few minutes and you're gonna be like ready to go after it, and there's not gonna be any side effects. That's what they give you, like the whole picture of the surgery, which is not the reality. And I think that's a huge mistake, because then after you go through the surgery, um yeah, you're basically left on your own to face all the post surgery effects, all the side effects as well. So give me a brief on when you went through the surgery. How was it? How was the experience after that?
So, like in my first surgery, that was a laser surgery done, and the doctor had told me that your problem will not reoccur again. So, they had given me assurance that this surgery will cure your problem, and this is the only ultimate solution for your problem, right? So, they told me that okay, it will be a day procedure, and you can easily get discharged, and there won't be any issues. And they had not told me about like the post operative procedure, like what are the things which I have to take care of post my surgery. They had not given me any kind of assistance on that, and that's the reason why I was not able to get to know the root cause of my surgery, because I had assumed that because of my surgery now the things will not come back, and I can eat whatever I want, and I thought that okay, now the problem will not come back. So but the initial problem was still there, right? The initial level of stress or anxiety was not what was not cured.
Mhm.
So that's the reason why that problem came back after 2 3 years. And that's how I realized that doctor had not given me the clear picture that okay, this is something which can reoccur. And I think that it should not I don't know if that should have been the ultimate solution, because if it would have been the if the doctor would have known my cause, then he could have suggested me some alternative solutions to my problem. So
Yeah,
that
and I
was
think yeah, I
yeah.
just wanted to mention that this was not a regular hospital. Like, this was one of very big hospitals in India. So, and the surgeon was very experienced, the doctors, everyone was really experienced. So our expectation was really high. um and then also I just wanted to mention another part is, like, I don't think they mention the side effects of, like, other things as well, like anesthesia, for example. Like, they give you anesthesia during surgery, and its effects last for, I think, a couple of weeks,
Yeah.
depending on the person.
Yeah.
um but then they just tell you things like, before the surgery, oh, you can go to your office like next day. I
Yeah,
think
like they
that's
take that procedure very casually, and the
yeah.
person also feels that okay, it's going to be very easy procedure. So
Mhm.
instead of preparing that person, they tell that okay, it's just a simple procedure, and you will easily get discharged, and you can follow your normal routine of going back to the office. So that's something
Yeah.
which I feel is totally incorrect and totally false information given to the patient.
Okay, so we are coming on to our time, but in the end, I just want to ask that, if you had to give advice to someone who is going through like a similar experience, what would you say to them?
I would say that you should, if you are having some health issues, right? There are a lot of things which we are not aware of because the doctors don't give us the proper information. So I would say that if you are feeling certain kind of health anxiety, I would say that sometimes just doing some normal deep breathing exercises or relaxation exercises can also heal you, right? So you don't always have to rely on doctors giving you medicines, because that's instant gratification which you get, and the problem which is going to get solved only on temporary basis. So it's not going to solve your permanent problem. So if you feel that you have got some lifestyle problem, then you should be your own psychologist or your own healer, because once you will start taking responsibility on your own, then you will definitely won't lose hope, I would say. So because my experience with doctors has not been so great, so uh, I had regained that strength and hope once I had started working on myself and taking accountability for my own actions in order to heal myself.
Yeah, and then I would say that another thing that is really important is having a support system, having a really good support system. So if it's like your family or your friends, your cousins, anyone, you should have at least like two people in your life where you can go talk to them, take their advice, discuss everything, even if it's like really personal. But it's really important to have someone in your life who can encourage you, who can give you hope, who can, understand you, sympathize with you. So having a really good support system is also a huge part of your recovery process. So I think that's something that is really important. Another thing I wanted to mention was, as Pratibha mentioned, and something that you also did yourself, was like doing your own research, but also, you know doing it in moderation. So obviously, don't go and Google search everything,
Yeah.
but you can definitely do a little bit of research, um, and talk to like different doctors, so that you can have different kind of opinion on everything, and not just like dismissing any kind of like other treatment plans, other kind of holistic approaches. So those are the things that I wanted to mention here. And we will definitely be doing this series of talking about our health issues and also like other challenges that we have faced. Hopefully, this was helpful to everyone. And I really want to thank you, Pratibha, because, this is something very brave that you're doing, that you're sharing your personal experiences, you're sharing your struggles, your challenges, you're being vulnerable, you're being open, and that takes huge courage. um, so I want to really thank you for that. And we will continue to spread this awareness and help others as well. And yeah, I just hope everyone learns from it and shares this with other people as well. And in the end, thanks for listening and have a good day or good night.
Thank you. Thanks a lot. Bye bye.
Bye.